takes me a while.
Stop it.
What? Live long and prosper.
Right. You said beam therapy, and how does this involve?
Welcome back to Liquid Lunch. We got Sophia here. Sophia?
Yes, hi.
Hi. Great to have you back. We're going to learn something all new today, because I know you're going to talk about something I've never heard of before.
Fantastic.
Yes.
Yay. All right, beam therapy.
Beam therapy.
B-E-A-M.
Let's take a look at it.
Okay, these are the tools of my trade. BEAM stands for Bioenergetic Emotional Access Method. And inside my magic box here,
Whoa.
these are the common issues that everyone is affected by. And common issues and emotions and allergens. The cameraman's having a hard time with this.
There we go.
There we go.
Envy,
Wow, that's a
jealousy.
big area.
Yeah.
Anger.
Yeah, that looks good.
That's perfect.
Helplessness.
Focus.
Fear.
Now,
terror.
the only apparently positive emotion there, in case you caught it, was joy. And that's due to the fact that a lot of people have some stress around joyful occasions. Like say you have had an alcoholic in the family, every joyful event, there's the potential for something going awry. And so a joyful event stresses them out. So that's why joy is there. Otherwise, it's all bad times in here. As we said, rage, anxiety, resentment, betrayal, rejection, all that stuff that we all have at least a few layers of, if you've lived in the normal world.
So what is a person, should they, what, so,
okay, so what's
what
inside?
are those things?
Yes, so these little vials, inside there's actually just saline solution and a drop of alcohol to preserve it so it doesn't go moldy. But there is a fabulous naturopathic doctor in New Jersey named Sandy Radomski, and she and her husband came up with a machine that can imprint the energetic frequency of these emotions into these vials of saline.
It sounds it sounds like homeopathy.
Yeah, somewhat, yes, except we never open these. We never ingest them.
Really?
No. All I do is I muscle test to see what's affecting you subconsciously. Okay, so...
Okay, let's do some right now, because I couldn't tell what it was with Sue.
Oh, did she talk about muscle testing?
No, but...
I didn't hear that part.
couldn't
He just
identify
wasn't
the
willing to
problem.
verbalize his issues,
okay,
so maybe.
So, you know what? I can't reach you. We have this awkward table in front of us. If you were... we're not going to...
we don't have to.
No, I will, because it's a very
You can
good
do
question.
it while we have this shot so everyone can see it.
Well, there's an alternative to me touching him, though. Normally, you would put your arm out. It's a deltoid test, and then I would put 2 pounds of pressure on your wrist as you're holding a vial. So if you're holding the vial and you remain strong, that means you're okay with that issue today. But if it weakens you, that means it's brewing subconsciously. It's affecting. It's one of your filters.
I
Okay,
see.
it's part of your energetic debris in your field. Now, I have about 90% of my clients I treat at a distance. That means we're not together.
So how do you test for that?
Well, I use myself surrogately. So if I know you, I just think of you. If I don't know you, I ask to have a picture emailed to me, and then I just tune in by looking at the eyes. And I hold out my forefinger, and my forefinger represents your arm, and then with my middle finger I push down. So that's like me pushing on you. Okay? This takes, I've practiced this for years. So I just think of you, so then I would say, okay, Hugh, show me what's weak for Hugh today. And strong is like that, and weak it slides off. So I touch the vial, and I say, and I just think about you. So all these are weak, which is normal if you haven't had treatment. You're okay with having to please.
What does that mean?
Well, that means that you don't have trauma around having to please others today. It's not affecting you today. Envy is not an issue, but you see how many of them are weak? And see how quickly I can test. So in under a minute, I can test the entire box, okay? And so then I know what's going on with you. So I take out the ones that are strong.
So
we don't need
basically,
those. You have all
You're
these
a mess.
issues.
I have a lot of issues.
Which is very normal. Everybody does, because, I mean, this is going to be mostly early childhood stuff. It's not just last week, okay? So if I was treating you in person, you would put all these vials in your energy field. That means on the chair beside you or at your feet. And basically the frequency tells your subconscious mind, okay, this is what we're dealing with today, roll tape. And when we do it, it's a 14 chakra clearing procedure. So we start at the top and you hold that. And let's say what I do is I test to see what the priority issue is for today. So let's say it's resentment. Okay, so then you would you would hold and say, I felt resentment. And I muscle test to see when it's time to move to the next one. I felt resentment. As you're doing that, you're going to see a little home movie of times where you felt resentment and it really hurt you. Sometimes people don't see anything, that's fine. And if you see the movie, it's not re-traumatizing. It's sort of a bird's eye view. It's like an old, scratchy, black and white movie. You just acknowledge that that happened, and by doing that, it neutralizes the trauma. So that's one layer of that resentment cleared. The good thing is, the bonus is, even though we're focusing on resentment, because all these other vials are in your field too, you get a little bit cleaned up from them as well. Okay, so that might take anywhere from, like a minute to 20 minutes to clear resentment, because we use, as I said, 14 chakras from top to root. And then we go to the next issue that's the most important today.
Boy, that could take all day.
No. The session is an hour. Usually 4 to 6 issues are cleared per session.
Yeah.
And I include common allergens, such as mold, dust, pollen, horses, cats, dogs, dairy, sugar, wheat, citrus, and yellow food coloring. These are common allergens. So that means if, say you were eating an apple, and you're 5 years old, you're on the porch steps, and you watch your cat get hit by a car, your subconscious links the apple to that trauma. So if you have many traumas with apples in your system, you could become allergic to apples. So a lot of allergies are emotionally based like that. And so the common allergens, as I said, dairy, sugar, wheat, citrus, and yellow food coloring. And interestingly, yellow food coloring is a North American thing. I always know if somebody was raised elsewhere, if yellow food coloring is never weak. And I'll say, oh, where did you grow up? And they'll say, oh, South Africa or something. So they don't put yellow food coloring in their
So
candies
that's
and cereals. Yeah.
I mean, that you can tell that just by doing that process that you just described.
Yes.
You can tell somebody's.
That's just an interesting thing.
I mean, it's kind of a proof in a sense of this as that it works.
Yes, or if somebody's mother only cooked from scratch all the time, they won't have some of the additives. And I do have a whole box of food, so not just the common ones, but everything.
I think that's a really important one, because food is a huge issue
Yeah.
for a lot of people, whether they realize it or not.
Yes, and I'm including the food vials when I do beam therapy. I just didn't bring them because this is the core of it. So I'm just demonstrating this today. And so it's a very gentle clearing. The great thing is you don't have to tell me what your memories are. So when I do it with someone, whether we do it by Skype, video Skype, by phone, or in person, I'll say, did you have any memories? They may say yes. Is there anything you want to talk about? No, that's fine. I don't need to know, because talking about it continuously just re-triggers you. It reinforces the problem, I think. This just neutralizes it. And so people feel clearer, rejuvenated, and all sorts of little pesky things start to diminish, whether it's physical issues or relationship interactions. It's amazing how your life can improve if you're energetically clear.
Interesting.
I just want to go back to what you said about talking, though. Are you saying talking with this, or in general, it's almost like eliminate the talking a bit? Because
I'd say eliminate the talking. It's good when you need to rant. Yeah, it's good when you need to rant, so maybe a couple of talk therapy sessions are okay, but after that, what my clients have said and what I experienced in my history is talking only makes you eventually feel worse, because you're reinforcing all that trauma. You're reliving it, but you're not, see, talking about it doesn't actually clear it.
But what about like reprogramming through talking? So speaking in a way that allows you to let go versus kind of venting about it.
Yeah, well, that's different.
Right.
That's a system to neutralize the trauma. That's fine. But just regular talk therapy, I really have questions about, because I don't see it being effective long term.
Okay. This is very interesting.
Yeah.
So, because I have many clients who come to me and say, I've been in psychotherapy for 25 years, and then 3 months of being changed my life. Which
Really?
I kid you not. It happened with me as well. Same situation. So, after a little concentrated effort with beam therapy, and I was a different person.
Now, did you do it yourself?
No,
or
I
were you
went to have it
working
done.
with another practitioner?
I went to the developer of beam therapy, who is an MD. She's a Toronto MD, Dr. Joan Beattie, and she and I both studied 2 other healing techniques. One is called allergy antidotes, and that's the doctor in New Jersey who developed the vials for allergies, and she's doing great work with autistic kids by clearing their allergies with these vials, and their behavior changes. So we studied that, and we also studied something called Seymour matrix work, which is the trauma clearing with the chakras. And so Joan was smart enough to put the best part of both of these treatments together and come up with beam therapy.
In Toronto.
That's very cool.
Yeah. She's here. She has a 6-year waiting list.
Wow.
Yeah,
Of
she does
what?
not,
Of-
for
of-
beam treatments. She does not do physical appointments anymore. She hasn't for years. And so I was one of the first people she trained to do this, because after it worked so well for me, I thought, I have got to know how to do this.
That's great.
Yeah.
So I'm just curious about the autism for a second. So based on what you said, this is an effective treatment for autism. Based on autism as being a result of allergies?
Yeah.
Is that really what it is?
Well,
mean,
I'm not
you
an
know-
autism specialist.
Oh, I know.
Right,
I know.
But,
And we
yes,
can't.
absolutely.
This is just for entertainment purposes.
yes,
people.
exactly.
Do not listen. Sorry, but
Don't
I do
sue
want to
me.
hear what you have to say about this, because there's a lot of people out there dealing with
Allergies
autism.
can cause violent reactions. I've seen videos, actually, when I was studying the allergy antidotes system, where a child was given just like a tiny speck of egg, and he went from being calm to literally throwing chairs across the room. And then they gave him the homeopathic remedy for egg, and he calmed right down. Yeah, allergies can cause terrible things.
And the whole thing about allergies is because we are more stressed now. Our bodies are stressed by the pollutants in the environment.
Our food, the air,
Like,
everything.
why are so many kids these days allergic
Yeah.
to peanuts?
The thing
When
is,
I grew up,
weak
they
immune
weren't.
system,
That's
though.
because of toxic load in the environment, I think.
Hold on, peanuts is something different. Peanuts is peanut allergy is specific to North America. In other parts of the world, they roast the peanuts slowly and properly. In North America, we're so crazy about high productivity that the plants here, they roast the peanuts too quickly at too high a temperature, and that triggers a latent protein strain, and that's what the kids are allergic to.
All right.
So that's a
That's
production
a whole
issue.
other, that's
Yeah.
all linked to a whole bunch of things, whether it's
Yeah.
allergies, food, autism,
Right.
injections.
Yeah.
So that's a whole other story, but it's very interesting. I would like to talk
in terms
more
of
about it.
allergies and beam therapy, I had a hairstylist who came in. She loves her job. She's a great hairstylist, and suddenly she was allergic to hair dye. And coloring hair, of course, was part of her job. And she said even wearing gloves, she would get a rash under the gloves. The dye would make her nauseous. I mean, it's not a great smell, we know that, but it was just kind of all of a sudden she couldn't handle it, and she couldn't go to work at all. So she came to me, and I said, well, let's just clear stuff. And I mean, I don't have a hair dye vial because it's not a common allergen, but we worked on the emotions. And her emotions were betrayal, humiliation, abuse. And we did 3 sessions, and after that, the allergy just vanished. And all the issues we cleared were related to how her boss was treating her. He was abusive. He was humiliating. She just kind of felt stuck in that job. But after we cleared that, her confidence went up. She got a new job, and the allergy was gone, which was amazing to her. She thought she would have to get a new job.
Wow. Okay.
So-
Yeah.
So, for people watching this right now, like what kinds of issues would they be dealing with that you can help them with this approach?
Truly anything. Well, let's see. A lot of people come because they have childhood sexual abuse issues, and that's still all too prevalent, unfortunately. That will clear. And if you have suffered that, it really affects all your life. So you really need to work on that. All sorts of physical trauma. Physical trauma is even medical interventions. An injection is a physical trauma. An X-ray is a physical trauma. So we've all had that. Abandonment. It's amazing how many kids feel abandoned just because mommy goes to work, right? So I just want to mention something in terms of children. Adults will see a child suffer through something, and in a couple weeks they say, oh, the kids are fine, they're resilient, they bounce back. No, they're not resilient. They're good at suppressing. And, never underestimate a trauma that a child has had. Because now, when they're 14, suddenly they act out. Or when
Right.
they're 21, nothing's going well. So you need to clear trauma really on a regular basis because we have daily stressors. What's great is that a lot of new moms are realizing that their babies do absorb everything that the mother thought, felt, ate, and so I'll have new moms call me and say, can you please clear my baby? Can you do beam therapy on my baby? And I do. And so there's some Italian researchers who discovered that the ovaries know which egg will be released down the fallopian tube 2 months prior. So you have absorbed everything your mother felt and experienced from 2 months before your conception. So imagine that. Imagine if she's in a not a great marriage, or it was an unplanned pregnancy, or all kinds of issues that you just come in with. And so that needs to be cleared. And with beam therapy, you do get those ancestral clearings. Yeah.
Wow. It's incredible.
Very interesting. We
Okay.
should definitely talk more about it
Yeah, I wish
sometime.
we could talk more about it today, but we have to move along,
That's
Sophia.
okay.
But for people who are, resonating with you and resonating with what you're saying about this, what's the best way for them to get in touch with
My
you?
website has my contact information, sophiazoe.com. And there are video demonstrations on my website of all the techniques I do. So go and watch some internet TV.
Okay.
Yeah.
All right, great.
We love internet TV.
Yes.
Yeah.
Good
Thanks,
seeing
Sophia.
you as
Thanks for having
always.
me.
Thank you for sharing.
You're welcome.
Okay. We're going to take a quick break, come back with Zoltan Barbaros.
Barbaros.
Raconteur right after this.